Good evening. Welcome to Montgomery Heart Wellness. I hope you had a great weekend and, of course, a great Sunday. I am joining you here, and we're going to talk about Charles Barkley's 60-pound weight loss. Uh, it's going to be a little bit of a long discussion, a lot of information here. Many of you know Charles Barkley. He's NBA. Many of you may know him as a basketball announcer, but of course, I remember Charles Barkley in his great days playing in the NBA. He's an NBA Pro Basketball Hall of Famer. We all know about Charles Barkley weight issues, and of course, recently is in the news. He's lost 60 pounds. So let's get into this. So we know that Charles Barkley was on the medication Mounjaro. And there's a lot of information about this medication and similar medications such as Ozempic and Wegovy. And these are special drugs that have been in the news a lot because lots of stars and actors are using it. So I want to talk about the drug, particularly Mounjaro, but similar mechanism of action for other similar drugs such as Ozempic and Wegovy, so you can apply a lot of this information to those medications. Now, what do we know about Charles Barkley's situation? First and foremost, we know that he lost 60 pounds in 6 months. So there's quite a bit of weight loss. And he was on the medication Mounjaro. That's a once a week injection. He went from 352 pounds to 290 pounds. This is from January to May. This is about a 17.6% weight loss in 6 months. So it's quite impressive. And he's been taking the medication Mounjaro, as I said before. And so how did this medication work? It's important to understand, mechanism of action. So you're taking the medication, how does it work? How is it broken down in the body? Because the mechanism of action of a medication is very important because how it works, could be beneficial, but there could be some question marks in terms of the mechanism because medications, the endpoint isn't always the key aspect of things. So I want to get into the details of how it works because this is going to give us some insight into potential side effects. But before we do that, I want you to give us a thumbs up. And if you're new to the channel, subscribe. And of course, share this information with anyone you know. So let's get into it. So how does Mounjaro work? First of all, mechanism of action. The main mechanism is that it decreases food intake. It works by slowing the speed in which food travels through the digestive system. For the most part, it delays gastric emptying. So it makes you feel fuller for a longer period of time. And studies show that there may be an action in the brain. So there's a central nervous system effect to this drug. There's also GI effect to this drug. So here's a little diagram. I like to learn things by looking at pictures and diagrams. And so here we see there's a complex diagram. You consume food, it goes into the GI tract. Now, normally when you consume food, the body releases these hormones, the GLP-1 and GIP agonists. These stimulate receptors in the body that normally slow down gastric outlet. So it makes you feel full. So when you eat food, you have hormones that secreted that normally makes you feel full. That's important because, if you're eating, you don't feel like you've eaten anything, then you just keep eating until you get sick. So the body has a feedback system that says, well, when you're eating food, your stomach gets filled, it secretes hormones, sends signals to the brain, and it tells you that, hey, I'm full. We're going to slow things down, let the stomach break things down, and then we'll pass it through. So this is all important. However, the mechanism of action is that there's certain enzymes normally that break these hormones down. So these GLP-1 agonists and GIP agonists, they don't hang around for long, okay? However, what happens when you take this drug Mounjaro, it eliminates your body's ability to break these hormones down. So these things hang around for longer than they should. And the question mark are there chronic effects or the potential adverse effects to that. So that's important to understand because if these things hang around, they're not supposed to hang around, that can lead to other problems. We'll talk about that later. So as I said before, it acts at the brain, suppresses hunger, and of course acts in the stomach. So it delays gastric emptying. So essentially, it causes constipation, but it causes it high up in the GI tract. Here's a little bit more complex slide. Mounjaro is a medication, as I said, is similar to Ozempic as well as Wegovy, except Ozempic and Wegovy has mechanisms on this side. They only activate on this receptor. Mounjaro works on this receptor. There's not a lot known in terms of how much this receptor agonist contributes to the weight loss. There's some thoughts that it may add to cardiovascular benefits and weight loss as well. But I just want to give you this complex slide to be thorough for those of you who want to have a medical background and want to look at the more detailed insight. But what are the potential side effects of Mounjaro? So side effects are important. And so right off the bat, the major side effects, inflammation of the pancreas. And in fact, there are some reports of the possibility of pancreatic cancer, low blood sugar, of course. There could be serious allergic reaction. Any medication you take that's new, you can have an allergic reaction to it. Kidney problems, severe stomach problems are possibilities. Changes in vision. The individuals with diabetic retinopathy can get worse by taking this medication. And of course, you can have gallbladder problems with this medication. And one of the mechanisms is constipation. And that's along the lines of the common side effects. So what they saw most of the time in the studies were nausea, diarrhea, decreased appetite, vomiting, constipation, indigestion, and stomach pain. And these things are all associated with constipation, which is the mechanism by which this drug works. However, the side effects that we know are not necessarily all of the side effects. We often learn about new side effects of medication once it's in the general public. Sometimes we do registry analysis, and when these drugs are out in the general public, it can cause more problems. So what are the long-term effects and questions? They're largely unknown. The long-term effects are unknown. We haven't seen this drug in the market very long. Can it cause problems worse than we know? We know patients who discontinue these medications. So if they have to go off the medication for whatever reason, or it's discontinued, the weight comes back and the bad eating habits come back. So the effects of the medication primarily last for as long as you're on the medication. So the concern is for potential increase in adverse effects on the body's organs, potentially leading to other more serious health issues. If you're taking a medication for 10, 15, 20 years, what effects is it having on your pancreas or your GI tract or your brain for that matter? We don't know. And of course, Mr. Barkley himself, and I quote, "At some point, I've got to get off the drug, but I feel so good physically, I've got to make sure I don't get fat again." You don't even realize how crappy you feel until you start losing weight. So he knows he has to get off the drug, but apparently he is thinking of an exit strategy to where he can maintain his weight. However, what are the alternative approaches to taking a drug? There's a lot of information about taking the different drugs for weight loss, and we're always looking for the magic pill. However, what are some approaches that are more natural, that are healthier, in my opinion, that can be used for weight loss? And I want to share some information with you in that regard. And I'd like to talk about part 2, and we're going to go beyond the script. So let's go beyond the prescription medication, beyond the prescription surgery, and see what we can do in terms of medication. Without medication, I should say. And so let's look at this patient that we treated in our center. And I've talked about this patient before in other videos, and I put relevant video links in the notes of this show, so you can look at other videos that talk about similar approaches to improving health. So this patient was morbidly obese and he was sick. Charles Barkley is 60 years old. This patient is 63. He had a history of a myocardial infarction and had bypass surgery a number of years prior to seeing us. He had hypertension, diabetes, and he also had kidney disease. Now, one of the potential side effects of a drug like Mounjaro is kidney failure. So this patient would not have met the entry criteria for taking one of the GLP-1 agonists because of the fact that he had pretty advanced kidney disease. Also, the patients in the study for Mounjaro and similar drugs were on average younger than this patient, although Mr. Barkley is about his age or just 3 years younger. But the average age, I think, in the group of patients on this drug is in their 40s. So it's about 20-year age different than the patient that was studied. And that's important to know. You should always be aware of situations when you're dealing with a particular drug. And so, okay, well, the research studies show that this drug does X, Y, and Z. Okay, that's wonderful. Those are the headlines. But you want to understand the details of that research. What population of patients did they study this drug in? Was it older patients? Were they very sick? Were they on lots of other medications? If they were not on lots of other medications, and let's say you were older and that population was younger, and you're on, say, 15 medications, that population's on average of 3 to 4 medications, that's a completely different population. And so the safety findings in that group may not apply to you. So you always want to have some idea as to, a drug that comes out. Typically they give you the headlines, but they don't always tell you the nuts and bolts of the population that was studied in, because it may not apply to you because you may not fit in that population. But anyway, so let's go back to our patient here. So vital signs, blood pressure is normal, weight 275. So he was morbidly obese, a BMI of 43. So what did we do? Well, we applied an integrative health approach. And so step one is with nutrition. So we are very aggressive with nutrition because really you have to learn how to change what you eat. And that's a psychological thing. Lifestyle change by definition is a change of the lifestyle, and it's hard work, and it's a mindset. And so someone like Mr. Barkley, who's very high achieving, he's a pro basketball Hall of Famer. I saw him play. He was a great player. And although I didn't see how he got to where he was, I would be willing to bet he didn't take a pill to get his greatness. I think he had to go through hard work and dedication and a change in his mindset to get to where he was in the NBA. And the same thing is required to improving your health. So step one is nutrition. Let's look at this patient. Now, this patient was somewhat unique. He had lots of clinical problems. He was on a lot of medications. And what we typically do is we start off and try to medically stabilize our patients. So it's always for patient safety. We evaluate them clinically, check their blood pressure, evaluate their heart, stress test. And this patient underwent a complete cardiovascular evaluation with blood work. We looked at the medication he was on, make a decision. He didn't have to be hospitalized. So these are the clinical things that we do for important reasons, for patient safety, medical liability, and the like. Once we've made the assessment and decided that, okay, this patient, we can immediately start evaluating him and treating him on an outpatient basis, we start right away with a nutritional intervention. So what does that look like? Well, we just don't hand them pamphlets and say, eat this or don't eat that. We start with an aggressive nutritional intervention. Step one, we tell the patient to remove all potentially toxic foods, and we spell out what that is: animal proteins, processed cooked foods, eggs, dairy products, pasteurized beverages, alcohol, and the like. And step two is we put them on a raw plant-based diet with alkaline water, cold-pressed juices, fresh fruit, gourmet raw foods to satisfy the palate. We also then, step three, put them on a time-restricted eating. This particular patient was eating between the hours of 11 a.m. and 4 p.m. These are very, very aggressive guidelines in this nutrition intervention. And many of you may be asking, well, do I have to stay on this forever? You don't have to stay on this particular regimen forever, but we work with everyone to help them go on something less aggressive. But once you've done this regimen, say 30, 45 days, maybe 60, or even 90 days, your taste buds change, your outlook on food changes, your cravings go away. So there are natural ways of suppressing cravings that are long-term without having to take a drug. So this is something that's very important that can be very beneficial. So this approach, take a screenshot of this. You can apply this on your own. And if you went to our website and you look at our Jumpstart program, we also have videos to help you start that. So anyway, what's the next step? Well, clinical stabilization. We like to wean medication as soon as possible. So we take the opposite step in terms of prescribing more medications. We like to wean medication. So what does that look like? Well, This patient in this example was on these medications and the order in which we and notice he was on Ozempic. Okay, he was on Ozempic once a week. He had been taking it for some time, but he was still morbidly obese. So what did we do? We started with weaning medication. It's always key to figure out which medication you're going to wean first. I won't belabor you on the details. We do have an approach and a protocol that we use, but here's what we did in this particular patient. We stopped his insulin pump very early on. Once he started the detox approach, we wanted to be careful of the risk of hypoglycemia. So we tend to stop insulin early on because we rather let the blood sugars run on the high side, certainly not too high, but if they're in the 200s, low 200s, mid 200s, we're not too afraid of that. We just don't want to drop to 10 or 20. So we stopped the insulin pump within about a week or two of this patient. We discontinued the aspirin next. The atorvastatin, the statin drug, was discontinued after that. We felt confident that he was going to be able to control his cholesterol with the diet, as we've seen lots of results with that. Clopidogrel went after that, the valsartan, and then the Ozempic went soon after. All these medication changes happened within about 2 weeks. Bisoprolol, of course, went last. So he was able to wean off these medications as he went through the detox program. And coming off medication is key to improving an individual's health. We don't know frequently when someone is taking 3, 4, 5, 10, 15 medications. We don't know the interaction of these drugs. We don't know the synergy in which these drugs can cause problems. Sometimes we give 2 drugs for a synergistic effect for a benefit, but it could also be a synergistic effect for an adverse effect. So we are very diligent to wean or minimize the list of medication the patient's on, and we follow them closely in our clinical setting. So next is regeneration. So the patient on the detox diet, we're weaning the medications. What do we do next? Well, exercise. We have trainers on standby who work out with our patients on a regular basis. We try to do 3 to 5 days a week. It includes some high intensity interval workouts. Now, of course, patients come in at different levels. We have people who are in wheelchairs who can just barely walk. We work with them at their level compared to patients who can run or jump. And there are other regenerative therapies that we use. Beamer, that's electromagnetic field, improves microcirculation. We use infrared sauna therapy, improves nitric oxide production. And all those things help with the blood pressure improvement and overall detoxification. So in summary, what happened with this patient? Well, he started with medical stabilization. We weaned him off his medication. We started a nutritional detox, remove all toxic foods. We started on a fitness regimen, and we added some regenerative therapies. And the number of regenerative therapies we add may vary depending on how ill the patient is. And one of these days, I'll do a talk on regenerative medicine, because that's a big area that's coming in medicine, and many of you should know about it. So what were his results? So what happened with this patient? Well, let's look at it. Now, as I said, he had congestive heart failure. He had an improvement of his ejection fraction from 30% to 42%. So the ejection fraction is percent blood that's being pumped out of the heart on a given basis. And so he had an improvement in the ejection fraction. Also, the pressures, the filling pressures on the right side of the heart went down, and that's a good sign. The more congestion you have in the lungs, the higher the filling pressure on the right side are. And if that persists for a long period of time, that can result in hypertension in the lungs and also increased pressure on the liver. So what we saw here is that this patient's heart started getting stronger, and it started relieving the pressure in his lung. Now, that's an independent factor for someone with obesity who's on a nutritional detox. This is happening along with, and to a large extent, independent of weight loss. Now, what happened to his kidney function? Now, his creatinine, the higher the creatinine, the worse the function. It went up a little bit. This is between different office visits. But once he started the detox, the creatinine came down. That corresponds with an improvement in what's called the GFR. So his glomerular filtration rate, which is the rate in which the kidney filters the blood, improved significantly during this time. It went from, double the amount of needing dialysis. He was very close to needing dialysis to where it was almost normal here. So actually normal here at the end. So if you compare the improvement in his heart function, ejection fraction 30% with a GFR of 29. When the ejection fraction got to 45%, the GFR was 45. And so we saw improvement in kidney function, heart function was in parallel with the nutritional detox. His blood sugars coming off the pump did go up. Like we say, we like to see, we're okay with having the blood sugars go up, but guess what? It didn't go up too high. So, as long as it's under 200, we're satisfied. Even a little over 200 from time to time, we don't worry about it because you know that on the diet, it'll eventually come down. Oops, I didn't share these last slides with you. Let me go back here. I'm talking, didn't share my slides. Here, the creatinine went up, came down and improved some. Glomerular filtration rate improved significantly there. And the heart function, the EF, went from 30% to 45%. And the glomerular filtration rate, the kidney function improved in parallel with the improvement of the heart function. And of course, the glucose, which was a little bit high after we stopped the insulin pump, didn't go too high. And that's important because we're okay with the blood sugar going up a little bit high temporarily because we know it's going to come down. We're more concerned if you stay on the insulin pump, the blood sugar may bottom out and someone can get in real trouble that way. But despite the fact that the blood sugar went up a little bit, guess what? The hemoglobin A1C went down. Now, this reduction in hemoglobin A1C, this is about 5 months roughly, and we see a reduction of 2.4 divided by 8.4. This is a 28.6% reduction in hemoglobin A1C. Now, the reason I make this point is that, and I'll show you our scientific evidence shortly, but on average, we see about a 3.4% reduction in hemoglobin A1C in just 4 weeks. Mounjaro, it takes about 12 months to see a reduction in hemoglobin A1C of about 0.96. And so that percent reduction over 12 months is much smaller, and this is over 5 to 6 months, and we saw much larger. So we saw, 12, I had a 28. So we're about 29 times more effective in reducing hemoglobin A1C than that drug was. That's how superior this nutritional intervention is, 29 times. And what about weight loss? Everybody's excited about weight loss. In about, what are we looking at here? This is about, 6 months. This patient lost 71 pounds, which is a significant percentage of his body weight in just 6 months, in addition to all of the other improvements. The BMI went down accordingly. And so what we see here is we see an effect of nutrition and exercise, the old-fashioned diet and exercise, but this is not just a diet, it's a defined nutritional regimen. Excuse me. So this is something that's effective, and it's effective in multiple ways. This person reversed heart failure, reversed kidney failure, got off his insulin versus diabetes, and he lost weight, became more energetic. So this is something that's helping at multiple levels, and you're not dealing with. Also, he was able to get off medications, and he didn't create a medication dependency. As I said, with the drug for the weight loss, Mounjaro, people get on those medications, but that creates a dependency because we know from the studies, when they come off the medication, they start to gain the weight back. The bad eating comes back, so they get back on the medication. So what's happening is that you're not necessarily curing a disease or an ailment, you're creating a medication dependency. And so that's not necessarily healthy, especially when we don't know the long-term adverse effects of these medications. So the basic hard work and dedication and mindset is really important. And it's not as hard as you think once you get on a program such as what we've described. So what's the science? We've validated this scientifically in the medical literature. I've published this with some colleagues. We've shown how a defined plant-based diet utilized in an outpatient setting can reduce high cholesterol, blood pressure, and reduce medications. It also reduced inflammatory markers. We were the first to show a reduction of lipoprotein A in the medical literature. And these things happen in only 4 weeks. And also, we did a case series and showed the improvement of heart failure in the case series. So quickly, what are some of the findings we had? There were some biochemical and hemodynamic findings. I'm going to go over this with you fairly quickly. There was significant weight loss in 4 weeks, and there was a precipitous weight loss, of 2 to 3 pounds every week, 1 to 3 pounds every week, with a statistically significant difference. We saw an increase in waist circumference. Systolic blood pressure went down. Diastolic blood pressure went down. The number of medication was reduced. And that, again, I cannot overemphasize the importance of reducing medications. In this society, we're creating more drug dependency, and this intervention creates a drug independency. So it's a very important thing there. The hemodynamic effects on the heart, the pumping function improved. The heart became smaller. The LV mass is the size of the heart. So these hearts were enlarged. It became smaller. The amount of volume of blood the heart pumped out with each beat improved, which improves circulation, which is cardiac output, which improved. And here's some other findings. Inflammation went down by 30%. IL-6 as a cytokine went down by 23%. Plaque is an inflammatory marker inside the blood vessels. This went down by 16%. Fibrinogen, total white count went down by 22%. So the body became less inflamed on this nutritional intervention. And as I said before, we had a 3.4% reduction in hemoglobin A1C in just 1 week. None of the medications come anywhere close to this. They're just completely inferior when it comes to reducing hemoglobin A1C. And again, we've shown this many times in our clinical setting. This is a very effective way of not only losing weight, but of healing the body. I often say, people are not fat because they're sick. People are not sick because they're fat. They're fat because they're sick. And it's an important differential because we have to treat the sickness first. You need to lose the sickness, and then you'll lose the weight. And the best way to lose the sickness is to stop putting the poisonous foods in your system that brings about sickness to start with. So again, I hope this was very beneficial to you. If you like this video, give us a thumbs up and subscribe and share it with any and everyone you know and love, because I think this information will change your lives. So go to our site, look at some relevant videos in our notes, and until next time, you take care.